because the introduction of Lata Mangeshkar may conduct the whole day for listening one song. I believe that I will hand it over to her, over to Dr. Alisha Lodha.
Thank you. Thank you so much, Mr. Kamal, for such an amazing introduction. I would like to thank Deepa for, I'm really glad to be here. So moving on to my presentation, I will just share the screen. Is it visible to all?
Yes.
And
yes.
am I audible enough?
Yes.
Okay, so before we begin with the talk, I would just like to request all the members that you can keep your questions with you. We will take these sessions and I would be happy to answer all your questions, but do not write them on the chat box because it distracts a lot of members then. Yeah. So moving to my center, that is Trio Physiotherapy Clinic and Rehab Center. This concept of Trio came through a journey of 3 friends who started this entire education from our bachelor's to master's to aquatic training together, and we've come up with this concept of Trio Physiotherapy. Currently, we're running 2 centers. One is in Borivali and one is in South Bombay. Moving on to myself, Dr. Alisha Lodha, he's already given an amazing introduction. Thank you for that. I'm the owner of Trio Physiotherapy Clinic and Rehab Center. Currently the Vice President at Trio Physiotherapy. I've done my Master's in Aquatic Physical Therapy and Lymphedema Therapy. Mr. Shrikant has given an amazing presentation to what a lymph is and how one can help to get the, or to guide or to move the lymphatics into their actual systems. So I think you all are aware about what lymphedema therapy is. So moving on to the topic, that is posture and pain, which is a patient's perspective. Now, there is a reason why I chose this particular topic, because today I want to address what you as a patient or as an individual can do, having no knowledge of medical background, but still be able to understand what is the right thing that you can do for yourself. So few reasons why I have chosen this particular topic is, one, because of the lockdown. Yes, so a lot of members, a lot of individuals are facing a lot of problem because of the lockdown. That is in terms of reduction in their physical activity. They are more sitting at home in front of the computers, laptops, television. So that's one of the reasons why this particular topic plays a very important role. Not only lockdown, it is also before the lockdown, the kind of lifestyle that we are in, the number of working hours that we have, the kind of ergonomic or the workplace setups that we have also demand for this information. Thirdly, a lot of us do not have the awareness as to when is the right time to visit your doctor. We are not aware as to what to look for and why and when you should visit your particular or your doctor or your physical therapist. And finally, we fail to understand the responses in terms of your pain. So we do not understand how would you get better, or what is it that you claim that, yes, this is improvement or this is worsening of the symptoms. So I would be addressing following issues today. You will get the detail about what a good or a bad posture is. Secondly, you will be learning how to self-analyze posture. So you can try this at your home, on yourself or on your kids, your elderlies at home. You can try analyzing postures. Thirdly, we will also be dealing with problems that arise due to these various postures. And targeting the most important, because this is highly prevalent now and over the years, that is neck and back problems in relation to posture. And finally, I will share some details about physiotherapy, what are some myths, disbeliefs, and what are the facts about physical therapy. Now, moving on to the introduction. So introduction to posture, it's very important for one to know what is a good posture or what is a bad posture. Coming to what a good posture is, posture is not just about standing, sitting, or lying down. Posture also means the kind of balance that your body maintains while performing any specific task. So it can be either lifting a particular, lifting bucket full of water, or working in the kitchen, or say lifting some patient, lifting the baby. So how are those activities to be performed? What is the correct posture in each of those particular activity or specific task? Now, when we talk about posture, a good posture, it is more to do with balance in between your soft tissues, your bones, all your structures of the body need to be in such a position that the work is not that the work is equally distributed. So when I say work is equally distributed, for example, you have employees working at your workplace. You have 4 or 5 people working with you. say 2 of them are absent, okay? The load entirely falls on 3 members. Now, these 3 members would work for say 1 day, 2 day, 3 day, and they would keep working. But after a point of time, they would fatigue. So this similar activity happens with our body. Our body has been assigned beautiful tasks individually, all muscle in synergies, they perform certain activities. That activity, if performed synergically with all the other muscles, all the joints, all the tissues, then the activity is stress-free, and that is a good posture. Now, when we look at bad posture, so this is where the challenge arises. We do not understand the technique. We do not understand the right posture. And that's when we start loading specific areas more than the other areas. And that's when we land up with aches and pains either during the technique or during the task or after performing the task. Now, what happens with this bad posture? So like it is said that a good posture is a habit. So is a bad posture. The posture doesn't turn out to be bad immediately overnight. It happens over a period of time. Specifically, you will see kids, they are not aware as to what is an ideal posture, how they should be maintaining their sitting position, or how they should be maintaining their standing position, how they should be sitting with a support, without a back support. So if you do not have the awareness, you land up into altered postures. Now, this altered posture is perceived by your brain as a normal posture, and this happens over a period of time. In fact, a lot of patients come to the clinic with a head, just forward and pokey nose, and they think that this is the normal posture, this is straight. And when you make them sit in front of the mirror and ask them to correct their neck, they would come into this position. This is how the brain perceives it. When you're not having any visual feedback, your brain perceives this to be normal, and this happens over a period of time. So from a bad posture, when you have to move into a good posture, it needs awareness, it needs conscious efforts, it needs constant signal going to the brain. So that is when you will attain a good posture. So now, since I've explained what a good and a bad posture is, we will go through some images, not really getting too much into technical terms, but just give you some pointers that you can look for in yourself in front of the mirror, or you can look for your family members if they fall into any of these categories. So this is a posture in standing. You would have seen this commonly in elderly population. However, nowadays kids begin with this kind of a posture as well, too early for their age, but this is the kind of posture they attain. So if you look at the mid back, it's completely slouched. It's called the kyphotic posture. So look for this particular posture. It's very easy. A lot of people sit in this particular posture. A lot of people stand in this particular posture. It's very easy to identify. Moving on to the next. Now, this is another very common posture that is seen nowadays. This happens because of not bearing equal weight on both your feet. So the weight distribution is unequal. You will find, say, one hip moved more to one side compared to the other side. You would find the head rotated to one side versus the other. So you see this particular angle, it reduces on one side and it's more on the other. All these are indicators that this requires or this issue needs to be addressed. Moving on to this one, which is another very, very common population that you will find. This is called a sway back posture, where if you look at the head, it's completely ahead of your spine. The body alignment, your head moves ahead. And also if you look at the hip here, this is also in front. So this is a very common, these are very common postural deformities that you will find. So think about it, who falls into this category? Moving on to the ideal posture. Now, if you look here, it's very easy to identify what an ideal posture is. If you look at this neck shoulder angle here, it's equal to the other side. It means that your head is aligned well with your spine. Also, another pointer that you can look for is this waist angle with the elbow. So if you see this angle, it's equal on both the sides. However, if you had an issue with respect to the spine here, you would see the shift on either of the sides. Now, moving on to the next alignment, that is your knee. If you see both the kneecaps that in front, they will be in line with each other. If one has an issue with respect to the length of the body, if one has an issue with respect to the length of the leg, you might find the difference in the kneecap positions. You might find the difference in the hip region as well. So these are few pointers where you know that this particular individual is into an ideal posture or requires some consultation. Moving on to sitting posture. Now, this is the ideal sitting posture. let's see what's an abnormal or a bad posture, bad sitting posture. So as we say, extreme or excess of anything is not good. Just like that, excessive bending in the spine or excessive arching of the spine, none of these fall under good categories, because they actually stress or weaken one particular area more and stress the other area a lot more. So what is important while you're sitting is the neutral spine. What's a neutral spine? Where you're not into too much of bending and not into too much of extension, that is arching. So maintain yourself into a neutral position, and that's when your muscles are in their optimal length. They can work for a longer period of time without getting fatigued. So this is another very important posture. Now, what we would advise more to our patients is to have a sitting posture with backrest. So we have a lot of patients coming to our center saying that we have a backrest, we have a chair with good height and adjustable, but are you actually using your backrest? So there's a thin line between having a backrest and are you actually using, or do you really know how that backrest is to be used? So if you look at the first image here, the hip is slightly away from the back support and the posture is completely slouched with the head bent down. So there's so much of strain falling onto the neck. Also, the spine is losing its normal alignment. Now, if you look at the correct image on the right, you look at the hip, it needs to be completely touching the backrest. That's one of the most important way. That is how you're ideally supposed to be using your chair, with a backrest. So you need to have your buttocks completely in contact with the backrest and then lean behind. This will help you to work for a longer period of time versus sitting without a back support, because every muscle has its own capacity, right? We all have our own threshold. So even these muscles, they require rest. They are working whole day, holding your entire body weight, spine, neck works, holding your entire head. So all of these muscles also require rest. And considering or understanding the kind of working hours that we all are having, it demands for a longer period of sitting or long, duration of work. So that is when we need to understand the body's demand as well. The work demands wants you to work for a longer period of time, but your body demands to give it rest. So while working, this is the best way how you can give rest to your muscles. Now, this is, yes, very, very important for current generation. We all are completely into mobile phones and laptops. So coming to these gadgets, what is important here is, I would give you a simple example. Imagine yourself holding a bucket filled with water and hold it right at 90 degrees. Hold it for as long as you can. And now compare this with holding a jug of water close to your body. What is it that you will be able to sustain for a longer period of time? Which is that particular position? It will be more when you're close to the body, right? So similarly, when you're holding your head forward, this entire body weight is supposed to be taken care by your neck muscles. And now imagine, this is away from the neck muscles. So there's so much of effort, so much of load that your neck is actually going to require. Those muscles will need to work so strong to actually hold this entire weight of head. Now imagine yourself holding close to the neck muscles. This becomes much more easier for those muscles to work at their optimal length and work for a longer period of time. So your frequency of developing those aches and pains will go down considerably. So this can be performed either you're in sitting position, in half lying position, or either in standing positions. Now, this is another very important and interesting posture. So have you ever had this feeling of waking up in the morning with, say, neck pain or stiffness or back stiffness, and just moving or rotating your neck, or just stretching makes you feel better, or throughout the day when you start moving it feels better? Or do you wake up with a feeling of breaking or creating those cracks? You feel like just giving somebody, just walk over it, or just maybe apply some pressure and break those, like breaking those bones. So that is when you need to realize what is that causing this particular stiffness, or what is it that causes this kind of a discomfort and this feeling of breaking your bones. It can be related to your posture, basically on the mattress. So basically you need to understand how good your mattress is. Is it too firm? Is it too soft? Imagine a mattress being really soft and you lie down on it. Your entire body weight will go into the shape and your mattress will take the shape of that body. And over a period of time, it doesn't happen overnight, but again, over a period of time, your body posture starts changing. So you spend 8 to 9 hours in that particular posture, right? So there is so much of high probability for you to wake up with these neck problems and back problems. Sometimes it also goes down the knee, experiencing difficulty to wake up, walking freely, but also it takes, there is limping that is observed early in the morning when you wake up. So think of it if any of you fall into this category. Moving on to some unusual postures, yes, like we discussed the other postures, I would like to address these few deformities, which is commonly seen nowadays from kids as well as from geriatric population. So looking at the first image on your left, that's called the bow leg, which is very commonly seen in elderlies. What I would suggest here is this is not something that, like, from a normal angle, it goes down to a sudden shift. It is not a deformity which happens suddenly. This is something which again happens over a period of time, and you come to know about this through the change in the walking pattern, through mild shift of your knee position. Do not wait for this to worsen. Do not just let it go, because this is something then when worsens, it becomes, or it takes a longer period of time to get better. So the moment you realize that there is some change happening with your walking pattern, there is some change in the position of the knee, get consulted for the same. Now looking at the second image, commonly seen in kids where their knees are close together, their feet are apart, and they find difficult to balance themselves on uneven surface. They would also find it difficult to run because there is an increased frequency of the fall. So when you observe these specific things in patients, or in kids rather, look for help. The third image that you see again is a very commonly observed now. That is flat feet, where the arches, the normal arches that are supposed to be developed, they fail to develop over a period of time. So again, the similar complaint where they would find it difficult to balance themselves, they would have increased frequency of fall, needs to be addressed. So look for these kind of symptoms. Now, so moving on to our next topic, that is what happens, what are the issues that one goes through because of these postures. So commonest thing that we all come across is neck and back problems, which I will be addressing here on for my further slides. But apart from your neck and back problems, what are the other things that you come across? Most importantly, there are people undergoing a lot of digestive problems. Now, why does this digestive issue why is that under this category? What happens is because of the change in your posture, I'm sure Mr. Shrikant could agree to this, when there's a change with posture, the abdominal space that your systems or your organs require, that there is a change in that space. So now when there is a reduction in that space, there is change in the position of these organs, and that's when they fail to function effectively. Secondly, looking at the posture, when you say a lot of older elderly population or old age group people, you might see them slouched down completely and bent down, and then they find it difficult to breathe. It becomes so difficult to breathe because the mobility of your rib cage is affected because of the change in the spine. So it is all these, whether it's your spine, whether it's your rib cage, they are all connected to each other. So having problem at one particular area would give problems at the other aspects as well. So these are how they are all connected. And not to forget, it's not only the physical problem, but also mental problem. Because of these aches and pains, there is increased rate in the absenteeism at workplace. There is piling up of the task. There is increased add-on pressure for the same. There is change in mood. Your mood goes down because you're not able to reach the target, not able to achieve the target. Increase in the duration of work. Actually, you land up into more aches and pains. So this is an entire cycle, and we do not know where to break this particular cycle. So that's what we will be going through today. Now, there are some interesting facts that I will be talking to you about when it comes to what happens because of this posture, and there will be some things that will really excite you, or you'll be surprised to see how that particular pain from your spine can travel elsewhere in the body. Now, looking at this image, this is an image that you can see on your left, the pain that is exactly in the center spot of the cervical spine or of the neck region. A lot of you might experience pain from the center, going to your shoulder region, going to your blade area. A lot of times you experience pain coming to the front of the chest. Many a times you experience pain going all the way down till the fingertips. And you must be wondering what it is. You might experience some tingle, you might experience some radiating pains like, ants moving around. These are the kind of feelings that one would complain of. Many a times you would also experience these neck problems giving you pain, or experiencing pain in the neck or in the head along with the neck. Your pain might move to the head area, or also give you heaviness around the eye. You might experience ringing in the ears. You might experience giddiness. Now, all this picture, isn't it scary? Had it not been migraine, a lot of times patients get confused with this headache with migraine, and they've been taking migraine medications for years and years and years. Whenever there's a headache, just take a migraine, just take the medication and problem is solved. But what is happening to the cause? Are you able to address? Are you able to find out what the cause is? Many a times the pain in the arm, people would panic, get an ECG done, and it's all right. Is it a possibility that it's not the pain of the heart from coming from the heart? It could be coming from your neck as well. Many a times people would experience giddiness. This is another way how you, these are all differential diagnoses that that a clinical or an expert would do. So you need to understand that these kind of symptoms can, and it's most of the time statistically seen, a lot of times all these problems coming together arise from your neck. So whenever you experience neck problems and then you experience these pains spreading either to the head, either to the front chest, or to the back, the blade area, or going to the hand, you need to consult your physical therapist. So now, to understand what happens in these cases, when would you know whether you're worsening or whether you're getting better? If you see yourself moving from left to right, that is when you see yourself or the pain area moving from the center of the neck going to the right, that is all the way down to your fingertips, it is called worsening of the symptom. Whether your intensity of pain might be less, you might feel, say, the pain is 4 or 5 on 10 when it comes to the fingertips. And it has been much more, it has been, say, 10 on 10 when it was at the neck. You would think that the pain is less, but it's gone all the way down. So it's not betterment of the symptom, it's rather worsening of the symptom. And this needs to be, so do not wait for your symptoms to go all the way till the fingertips, or don't wait for the symptoms to travel to your head. Do not wait for the symptoms to spread. We need to try and get them back to the center, and that's the job of a physical therapist. Now moving on to, so then you know, moving from left to right is worsening of the symptom, and when you move from right to left is improvement of the symptoms. That means you're getting better. Now, similarly, again, a very, looking at the previous slide, you would be able to understand what happens similar to the lower back. As I said, your spine is a single unit. If there's a change happening to your neck, there will be an effect seen either on the lower back or going all the way down. Similarly, if there's a change seen at the lower back, you might experience this change going all the way up to the neck. And then you experience symptoms with neck. A lot of times, many of us would experience neck problems, back problems together. It is not because they are probably separately happening somewhere. It's all because they are connected as a single unit. So body has its own capacity to compensate for these problems, right? And that's why we just let it go. Like body will take care of it. Wait for a few days and see if it's getting better and then just let it go. But what happens is, because we fail to understand what has caused it, once again, when we are into the activity which has probably been the reason for causing this particular pain, we would experience this again and again and again and again. So that is increase in the recurrence of your problems, right? So again, moving from left to right is worsening of the symptoms. When you move from right to left is improvement of the symptom. Now, when I say worsening of the symptoms, it's not necessary that you experience back pain and that pain travels all the way continuously down to the fingertips. You might only experience knee pain. Can you see the second image down on the left? So that is the image which explains that a lot of patients come with knee problems. They experience knee pain without any history of trauma, young group of people, and they do not understand what is this actually, what is this knee pain about. And then they just take some medications, feel better, but again, this repeatedly they are experiencing knee problems. Have you ever thought if it could be coming from your back? You might have no history, no pain in the back, but you might probably have a past history of back pain, or maybe a slight niggle here and there, which we usually tend to ignore. We have a little niggle in the back, we have a little niggle in the neck, and we'd say, okay, let's just do some movement, do some releases, and feel good about it. But what is it that is letting this problem come again and again and again? So this could be coming from your spine. Now, moving on to the next. Yes. So now that we know what are the problems that could cause these symptoms, we know that what is a bad posture, what's a good posture, what are the dangers that you could experience, and what is the progression of this particular symptom. So now what do you do? So what actually is the current scenario, how people or patients or individuals look at themselves is, when you're in pain, whether it's neck, back, any area of the body, go for a massage and see, look at this image. She is feeling amazing while taking the massage. And we all feel good about it, right? We take it once or twice a week, go for some massages every week, once in a month, twice in a month, and we feel good about it. Every time we experience ache and pain, we go take a release. What are we actually doing with this massage? We are just subsiding or just suppressing the pain. So to explain you a good and interesting concept of what pain is nothing but your body's way of communicating with you. Why do we cut down on that communication? We need to let that pain occur. That's when you know what the problem is. Imagine you're unaware about what is happening in your body, what is happening to your spine, and there is no pain at all. And suddenly you experience weakness in the entire leg because you didn't have any episode of pain. You didn't know that there was some problem happening inside. So you didn't bother to get it tested. And suddenly one night you wake up with complete weakness in the leg. Wouldn't that be scary? Now imagine experiencing pain is just your body's way to tell you that there is something wrong with the body and we need to figure out what is it. So instead of suppressing the pain, let us find out, let the pain be there, let us find out what has led to that particular problem. Another thing, if massages don't work, we go on to the medications. So whenever we experience pain, pop a pill and the pain is gone and I'm back to my activity, doing all my routines. But again, when I'm supposed to do the activity that actually gave rise to this pain, I'm scared. Or maybe I would do it, again land up into pain and again go for bed rest and take medications. For how long would this just go on and on and on and on? Now, massages didn't work, medications didn't work, visited multiple doctors, and then finally got an X-ray or an MRI done. And now you see on the MRI, oh, that there is this disc bulge out, L4, L5, very commonly this is out, the disc bulge is out, this particular disc is onto this particular nerve, my neck tissues are damaged, and creates a scary picture, right? And you all start thinking, now this is my back problem and I've got this on my MRI and now I need to get a surgery done. Adds on to your stress and adding on to your pain again. And this cycle just goes on and on and on and on and on. So where do we need to stop? Now I will take you through the series of what is that one thing that you need to actually look for in terms of physical therapy. So before I start off with how you would find the difference, I would want to take you through what are the disbeliefs that we have with respect to physical therapy and what are certain facts that I would like to address it so that it helps you to know where you stand. Now, what are various myths? So very common one that you see on the first image, that is an ice pack or a hot pack. We believe that ice pack, hot pack is the solution to every problem. No, my friends, that's just suppressing your symptoms. It's suppressing your pain. Now, to give you an easy example, it's like a teacher and student, right? Kids are supposed to follow what teachers command. These muscles, these aches, these pains are like kids. They've been given commands from some higher center. There's a teacher up there who's giving them commands to do this. We are just kind of muting or silencing the kids, right? So we are not working on the higher area where the problem is actually coming from. We are just working on the symptom, on the effect that you get because of the problem. So that's why the episodes of recurrence, experiencing this ache and pain every time that you do the particular activity is higher. Secondly, what I would want to also bring about to your notice is stretching. A lot of us, in fact, a lot of people who work out, a lot of people who lift weights, they believe that we cannot experience pain at all because we are so active. And whenever they experience a little bit of ache and pain, maybe say hamstring muscle is caught up or say quadriceps muscle is caught up, they would just go with stretches. Stretching is not the solution to your problem. Like the heat and cold, stretching is also not the solution. Another thing that I would want to address is, as a patient and as a physical therapist, things have changed, in terms of development of or progression of new techniques in physical therapy. So machines are something that is the very traditional approach. It's more to do with a passive treatment where the patient is not actively involved. There is no movement, no activity performed by the patient. You're just placed on the plinth and machines are applied and you go back. What is happening? You find the relief for that particular moment. But what are you working at? So I'm not saying that these machines don't work at all, but there is a very limited use of these machines. So we've had a lot of patients coming to centers saying that we come every month, we just want this particular machine to be placed on us. Every month you come with it and just take 5 sessions or 10 sessions. No, my friends, that is not really going to help you. is just a temporary relief, just like a massage or just like a Volini gel that we apply every time when we are in pain. We feel that this particular machine is addressing our problem. It's actually just reducing down your pain. But again, as I said, you don't need to look for reducing the pain. If you work on the cause, the pain will automatically go down. Thirdly, a very common, again, a very traditional approach where patients with back pain or neck pain are given 10 days of bed rest, or say, wait like 15 days of bed rest and take weights. Put a traction, add weights to your lower back and then start giving traction for 10 days. That is again a passive approach. You would feel better because it releases the pressure from your spine. But what happens once you're again into that loading position? You get back those symptoms, right? So as I said, that pain is okay. It is a good thing. That's the best way how your body can communicate with you. So another myth that we all have, that once my pain is gone, I will never have this problem. Specifically, I'm talking with respect to neck and back problems. Like, to simplify this, I'll give you an example of a machine. Do your machines require oiling, right? You require servicing, you require maintenance. Similarly, your body also requires that right maintenance, right servicing, right oiling, and right greasing. When you experience pain, you need to understand what is the activity that caused the problem. Once you work on the problem, you experience relief, do not give away on your exercises. What is very important, and that's where a lot of physical therapists fail to get the result, a lot of patients are not satisfied with the result, is because they lack adherence to treatment. They lack maintenance to treatment. Even after the symptoms are gone, you need to continue your maintenance program. Okay. Another interesting myth that patients have is that my back pain is equal to slip disc. Every back pain is not a slip disc. Every back pain that has a slip disc does not need surgical intervention. A lot of issues, especially looking at the MRI, as I explained in the previous slide, that look at the MRI and my disc bulges here, all these multiple levels, the disc is bulged, and now I need a surgery. No, it is not the need of the hour. That is not when you require surgical intervention. First, try out a physical therapy approach. When physical therapists will be the people to tell you that you're having result with physical therapy, or you are in a stage where you need to get a surgical intervention. So first, approach your nearest physical therapist. Another fact that I would like to share is, or another disbelief that people have, is take rest and avoid activity. Now, say for example, doing workouts gave you some ache and pain, and it went so bad that you started experiencing numbness in the leg. And you took rest for 10 days, 15 days, or say about a month, you didn't do any of your workouts. One thing, whatever workout you did for so long, your body's got deconditioned. Secondly, you've not trained yourself to get back to the workout. Thirdly, there's so much of fear that now, am I supposed to move? Is this the right time to move? I do not have pain. What if I experience pain again? So how do you get answers to these questions? You, instead of taking rest, you need to get yourself moving in the right way. Now, what is the right way requires an advice of clinical expert, right? So another concept that you need to now start moving from the passive or taking rest or avoiding activity, move on to correct movements, move on to active approach, move on to right movement at that particular moment. This will help you get better and get back to all your physical activities again without the feeling of pain or fear. Now, what are the various facts? As I mentioned that apart from the myths, now I would like to address certain facts about back problems, about neck problems, specifically talking with respect to that arise from the posture. Now, not all back pain are the same. When I say this, because a lot of us start doing Google research, what is the exercise for back pain, what is the exercise for neck pain, or maybe we ask our friends that you've been to this particular therapist and what are the exercises that they gave you, give it to me, I would like to try them, I would do them. Every individual has a different standard of working, different daily activities, different demands throughout the day, different working experience, different postures, different reasons for experiencing a similar back pain. You might experience back pain. You might experience back pain going down the leg, going down the knee. But what is the cause? Why is that happening? Since when it is happening? There are so many aspects to look at. There are so many factors, so many information that one needs to know and then prescribe an exercise. So not all back pain are the same. Secondly is recurrence. Now we all believe that we should never experience this ache and pain, right? So once a machine starts working, it should never stop, right? So for your body, throughout the day, there are so many activities that we are doing repeatedly every day, from one time that we wake up till the time we go to our bed. We are just working, working and working. So many times we land up doing tasks for longer period of time. We stress too much. Say 3-4 days we've done say excessive work. There's too much of workload. Like this lockdown, a lot of ladies are excessively working all the more than what they would otherwise do with no house help, right? So there's so much of load falling, which the body is not used to. So you might experience this ache and pain. So now this neck problem, back is more like cold and cough, right? We all experience cold and cough coming. It's not a disease. We all panic because of the neck problem, specifically with back problems. There is no need to panic. It is absolutely okay. You just require the right movement, because there has been, say, some excessive movement happening in one particular plane, which needs to be identified and corrected. Once you know about it, there will be a great reduction of recurrence in your pain, recurrence in the frequency of having this particular problem. And this will make you all the more aware about your body. Thirdly, long-term benefits. Yes, this is very, very important. We have been seeing that with these machines, with tractions, we are all working on short-lived, we get short-lived results, right? We feel better, 10 days, 15 days, 1 month, we are all good to go. But what about long-term benefits? Have you really benefited with those machines and never experienced back problems, never had neck issues, never had symptoms traveling down, or never ever you had to consult your doctor again? So long-term benefits are really, it is the goal of the therapist, and it should also be the goal for the patient. Maintenance is the key. As I explained to you, that if you want that there shouldn't be pain coming to me at this intensity, if I should not be experiencing back pain, you need not give up on to correct exercises. Go with a maintenance program, follow up with the physical therapist, get in touch with them to understand how you can maintain the issue, how you can prevent it from further increasing or further coming to you. And what we all as a physical therapist look at is patient empowerment. Now, once you experience a neck problem, we would analyze what is it that's giving you this particular problem. We would find out that movement that would actually get all of this ache and pain back to the center, and then no pain, and make you independent. That is very, very important, that ever again you experience neck pain, you don't have to come to us running, or you don't have to run to every doctor that now I have a neck pain, now should I take medicines, or should I go with exercise, or should I get an x-ray done? You will know what is the right exercise that your body needs to do. That is what I mean by patient empowerment. So we all need to understand, identify what our body requires. So it's just like, as I said, cold and cough, right? We experience cold. We know that we need to take certain medicines. We've experienced this before. And we take medicines and we are fine, correct? And say once again, after 2-3 months, you experience cold again. You know that this is a medication that you respond to. Similarly, the same goes with your neck and back problems. Once you know that this is how my body responds, this is that one particular exercise, and believe me, I'm talking about one particular exercise that will fix all your neck and back problems. So to understand what is that one particular movement that would fix your neck and back problems, it's very important to get an expert advice. And ever again in future you experience the neck pain or experience a similar pattern or similar pain in the back, you will know that this is the right exercise I need to do. If after doing few days of those particular exercises you do not respond, only then you need to visit your physical therapist. And that's what I mean by patient empowerment. So this is what has changed over years of physical therapy. That is, your passive treatments are now looked upon less effective than active and independent approach. I would finally like to conclude that consult your physical therapist at the right time. Do not jump onto x-rays and MRIs and add on to your stresses. Do not consider back pain and neck pain as a serious disease. It is not a disease. It's just like cold and cough. It's a mechanical issue because of the kind of lifestyle that we're living in. Get that addressed. And believe in active and independent approach. This is my contact details. We have our Facebook page. We have our YouTube channel where we share a lot of educational videos. You can check out onto our website as well. Thank you, everyone. Thank you so much. Do we have any questions?
Thank you so much, Alisha. Members and visitors, we have exactly 5 minutes for questions. If you have any, or otherwise we can proceed because we are a little behind time.
I have a question.
Yes. Who's this?
So
This is
I
Manish.
Manish. Yes, Manish. Tell me.
yes, I've been suffering from L4, L5 since about 15 years now. So
Mhm.
I know, is hot fermentation good? So that's what I've been relying on there.
Right. So
And
now, yeah, tell me.
yeah, so I've been a journey, and a lot of good surgeons in the city advised me for surgery. There was Dr. Ramani who said, just come in for a day for surgery and next day you can take part in marathon. But I've been very conservative. I've never went to surgery.
Right. So tell me one thing. With your back pain, are you able to still perform all your activities?
I do all my
Are you
activities
walking?
and
Are you
yeah.
walking? Are you sitting? Are you doing your household chores? Are you doing your business? Right?
Yeah. I play
So
tennis
if
and all.
you're exactly, so if you're functionally so active, there is no need for you to jump onto a surgical intervention. What is
Yeah.
ideally required to understand, and hot packs, as I explained in the previous slide, they will help you feel better. See, now it's been 15 years that you're going through the same problem, and
Yeah.
every time that you're having hot packs, it's better. But you want to do this throughout your life. You don't want to find out what is that cause giving you that back pain. So why not find out that one movement that will relieve this particular problem rather than going and suppressing your existing pain, which is just nothing but your body's way of communicating that you're still not addressing the problem, and you need to look at it rather than cutting me down, right?
Okay.
Have I answered your question, Manish?
Yeah. So I need to find out the exact cause. That's what you're saying.
Yes.
Okay.
So Alisha,
Hi, this is Johnson. Yeah,
Yes, Mr. Johnson, tell me.
yeah. I have a slip disc L2 to L5 with
Yes.
osteoporosis and
Yes.
right shoulder 90% tendon tear.
Okay.
So this has been there for last 7 years.
Hmm.
So it is better when I am resting at home, much
Right.
better.
Correct.
So one day if I just go to do a training or do a marketing or something, next 2 days I have to lie down for some time, so rest, and then
Yes.
it is a little better in that kind. So I
Exactly.
when
Yes.
you were explaining me explaining that the pain shooting into the hand, into the leg,
Yes.
that's what I started experiencing, and where I couldn't even hold a laptop in my hand. So that was the
Correct.
symptom.
Exactly what I meant by taking rest, and when you have to go back to your activity, you come back to the same problem, right? So you're actually not
Right.
addressing. Taking rest
Physiotherapy
wouldn't.
also I've tried; it did not help. They also
Yes.
put me
So
onto machines and
correct.
various
So that is a
exercises.
very important that you do not get into passive treatments. It is very essential to get into active therapy, as we mentioned. So the system that I explained to you is a McKinsey system, which we where all your traditional practices are put aside, and we basically focus on your symptoms, your pain, and that I would be able to tell you immediately when I assess you on day one. We'll know whether you're responding, whether you're not responding, how your pain is changing. So this is very important, as the image that I showed you, that look for change in pain areas, look for change in how the pain is shifting, not from pain is there and pain is not there. You need to explain the gap in between. So that is going to happen when you get more aware about what is the pain, how the pain changes in size, how the pain changes in intensity, how the pain changes in area. It has to start traveling to the center. That's when you actually improving.
Thank you.
Yes.
Ipa, can I ask a question?
yeah, quickly, 2 minutes. This will be a last question for the day.
Okay, thank you so much. Alisha, it was very nice.
Thank you.
I'd like to know one thing is, in the last 2 months, I'm experiencing the exact symptoms of what you said. I'm getting in my left arm, I'm getting pain, and I'm getting the numbness
Yes.
on my fingers. And I've been thinking that this is because of no exercise, not realizing that this is probably your neck.
Right.
I'm sitting in front of the laptop day in and day out, which I never did earlier.
So you already know what is causing
now,
the problem,
no,
right?
I came to know now. Okay.
Okay.
So that's thanks to you. Okay. Yeah.
So I would also want to address one more thing here, that the beauty of the exercise that McKinsey system actually involves, the beauty of the exercise is that you're supposed to do that in pain. When you are in pain, you're supposed to do the exercise. Unlike what we do with machines, we try to cut down the pain. We see that the pain has to come down, and then we prescribe the exercise. But the exercise that this system offers, or this the new approach offers, is to do with working or doing the exercise at the moment when you're experiencing pain, and you'll see that instant change. And that will really surprise you. So my advice to you would be not to wait for this symptom to actually worsen, but to get this corrected.
Got it. Thank you so much.
Yeah.
So members and visitors, Alisha has her clinic in Borivali and South Mumbai, and y'all can get in touch with me and I will share her details and you can contact her later. I repeat again, all the recordings of the two speakers today will be uploaded on YouTube and website. So do go through it whenever you feel like. Kamalji, can we do the thank you, please?
Sure. Before I thank, I would like to share my personal experience as well. I've gone through cervical pain in the past, and what happened was people suggested me surgery, but I just went for exercise and went away after some time. Then after a few years, I was undergoing the sleep disc problem, and I was in bed for almost 9 to 10 months. And again, surgery was recommended, but I went for physiotherapy and never had to go for any kind of surgery. 2 years ago, I had a arthritis problem. My knees was totally swollen, and I couldn't even walk to my washroom. That was the condition. Again, I was recommended surgery, but I didn't go for that. I went to a physiotherapist, and he showed me some exercise, and 100% fit and fine now. See, most of the people immediately learn to surgery, but thanks to doctor who know their job, actually we don't require. The doctors can help your body. So I would like to thank Dr. Alisha because the body language of her is fantastic. She has been very enthusiastic in delivering her speech. It was not delivering a speech for the knowledge sake. She was very much into it. And I 100% sure that most of the people would agree that she knows the topic well and she enjoys giving all the information.
Thank you so much.
Thank you so much for that.
Thank you.
Okay, I would like to thank the speakers today, Dr. Alisha Lodha and Shrikant Sagarji. As a token of appreciation, we would like to give you a certificate, from Vvennus Club. Let me just show it to you right now over here. And then we will email this to you because we cannot give this to you physically. Are you able to see it?
No.
1 minute. Just 2 minutes. So till I am just looking for the certificate, let me add over here that the talks were very insightful. Shrikantji, we loved the bee humming exercise and will definitely hum like bees, and I will remember you for sure. And yes, Alisha, your myths and beliefs were also very nice. So thank you so much for that. So this is for Shrikantji. Shrikantji, kindly accept this with gratitude. Can you all see the certificate?
Yes.
Shrikantji, unmute yourself, please.
Yes. Thank you so much, Deepa.
Yeah, this will be mailed to you. This will be mailed to you. And now the next certificate, I would like to present it to Alisha. Can you see this, Alisha?
No, the screen hasn't changed yet.
1 second.
Till then, members, I would, there are still a lot of questions that I would love to answer. So even if we are done with today's talk, you can get in touch with me and I would be happy to answer all your questions in person as well.
1 minute.
Thank you,
I have
Alisha.
somebody with me who's suffering with back pain since last 15 days. I'll make him talk to you after.
Definitely. And these cases with neck and back problems don't really need too much of physical contact. So we are currently dealing with maximum neck and back problems through online consultation because it's completely movement based.
In next 2 months. We're getting a lot of cases like that in next 2 months.
Yes.
Dr. Alisha, this is certificate for you. Thank you so much for your time.
Let's all clap.
Thank you so much. Thank you.
So I would quickly like to add over here that you must have thought that why did I choose Dr. Alisha Lodha when there are so many physiotherapists around, but I have had a first-hand experience. My mother had a fall and she was suggested surgery by 3 knee surgeons. I took her to Dr. Alisha, who first examined her without seeing the reports. And today my mother is free, physically active and without surgery. So thank you so much, Dr. Alisha.
My pleasure.
Big round of applause for her.
Thank you. Thank you so much.
Looking at a very large profile, I thought I will be looking at a very senior lady. She doesn't look senior at all, but do look sincere.
She is our chota packet bada dhamaka.
Senior
She is not
also
senior,
and
but sincere.
senior also and single also.
Yes, yes, yes.
No, young also and single also.
Thank you.
Yeah. So I hand over now again to VP. VP, you can just have the new members give their feedback, and the new visitors give the feedback, and the members who have left to be introduced themselves. So we can just do a quick round of that.
A guest, we would be glad if you could give some feedback about you. Dr. Alisha, we would be glad if we are able to start with you.
Yes, so I think this is an amazing platform. I've really enjoyed the informative session that you guys have had. I mean, Mr. Shrikant, I've really loved your presentation, and a lot of talented people here. A lot of you doing all different, into different professions. So it's an amazing platform, and thank you for the warm welcome. Thank you so much. Thank you, Deepa, for having me here. Thank you.
Always a pleasure.
Thank you.
Mr. Yunus, if you could introduce yourself and also give the feedback about the session.
You have to unmute yourself, Yunus bhai. We'll come back to him, Pranav. Let's go to Shweta Hirawat. Yeah, Yunus bhai is here. Yes, Yunus bhai.
What do you want me to say? Hello.
Whatever you feel like.
What was your feedback on the meeting, and introduce yourself as well?
Yeah, you can be honest.
I always believe in wellness, and I believe that we should do things without surgery, and we should be very conscious of how we conduct ourselves. I've been into this kind of wellness for about 7 years now, and so it was lovely to listen to Alisha, Dr. Alisha.
And tell us about yourself. What do you do?
What do I do? I am from Jaipur, and Deepa is my dear sister-in-law. I have to have a dear before my sister-in-law, so and I'm an artist, and I'm a full-time artist. I keep on doing my work. I paint, I draw, I sculpt. I was a teacher for 24